Okay, can people hear me? If I can invite people to head back to a table and we'll make a start on our afternoon session. Cool. So this morning we've covered what is sensitive data. We've thought of lots of different types of sensitive data. We've also thought about some of the challenges affecting the UK at the moment. And this afternoon is really about tying that all together, thinking how can we combine scientific data to produce outcomes that benefit the public. So as a quick recap, I know we covered this in detail, so I won't stay on this for too long, but we're thinking about data linkage. And by data linkage, we mean the process of connecting information from different places and different sectors, for example, healthcare and education, in order to reveal meaningful insights without disclosing identifiable information about individuals. Now, researchers often link records that are not already linked together to better understand how different factors affect one another. And by analysing sensitive data across different domains, we can better understand how society works, and those findings can allow us to develop better policies and services that enhance the benefit to the public. So why do we want to link sensitive data? I think we've already sort of covered this a lot this morning. There's many different advantages we can think about, both within sort of linking data in the same sector, but also between different sectors. So this includes things like understanding how different factors affect one another, having a more holistic and complete understanding of the factors that affect a group or an individual, and providing a fuller picture of the different forces affecting the UK population and its institutions. So by enhancing our understanding of our society, we can better understand how different interventions, whether that's policy decisions or the provision of public services, can affect us. And that can allow us to design better services that will sort of improve the lives of the general public. So as a bit of an example, putting this into context, what could this look like? So this example is about understanding educational outcomes in young people that have diabetes in Wales. So I'm sure a lot of you know this, but diabetes is it's a long-term health condition, affects around 40,000 children and young people in the UK, and it requires daily management. And the 4 UK home nations have legal commitments to support young people with medical conditions in their education. But there's significant challenges in providing evidence to be able to support those different interventions. So in order to establish the evidence base to support these interventions, researchers need to link sensitive data across the health and education sectors. So health data is things like whether the child has a diabetes diagnosis, and that's stored in the National Diabetes Audit. And education data is things like personal educational attainment attached to that child's personal school record. And that data is stored by the Welsh Government. And so if you can link this data together, you can start to answer the question, what are the associations between having diabetes and your educational outcomes, whether that's attainment, absence, or progression to university? So in this example, we're thinking about primary and secondary school pupil data. We're thinking about data from college settings, from university and higher education settings, right up to things like graduate destinations. And we're also thinking about health data, whether that's from the National Paediatric Diabetes Audit or the National Diabetes Audit for sort of adults onwards. So what we're going to ask you to do in this next session is firstly, please change up your groups, speak to some people you haven't spoken to yet today, and on each table you'll find a brown envelope, and this has a set of equation cards. So some pluses, some equal signs, and some pieces of paper to write down outcomes and benefits. And we want you to think about all the different types of sensitive data we've discussed this morning, as well as non-sensitive data that might be relevant, and also the challenges facing the public that you all brought forwards in our earlier discussions. And we'd like you to think about how those different types of data can be combined to solve specific problems and achieve certain outcomes, considering particularly who will this actually benefit. So we'd like you to populate the equation cards provided to help guide your thinking and ensure that every part of that equation is considered. And this will give you a sort of equation in the style of this data plus this data can produce this outcome, and it will benefit these people in these ways. And then once you're happy with your equations, we'll give you a sort of big template to record them down. And we want you to try and do this for as many different use cases that you can think of. So as an example, the sort of example I just discussed, we'd have academic attainment data combined with diabetes data, means that we can gain an understanding of how living with diabetes affects educational outcomes for children. And this can allow policymakers to design interventions that support them through the education system. and this benefits children with diabetes, so they receive the support they need. Benefits the wider society, because the quality of education could potentially be improved. And it also benefits policymakers and administrators, who can better target and understand the interventions they need to enforce, resulting in a more efficient use of resources. We can also think about enhancing these examples a little bit. So for example, thinking about non-sensitive data as well. So you might have personal health data, so for example, measures of lung and heart health. You might combine that with non-sensitive data about the environment, so for example, local pollution levels. And that means you can start to gain an understanding of how continued exposure to air pollutants in certain areas affect health at an individual and a population level. And this obviously benefits, again, policymakers and administrators. You have better evidence to support interventions, and you can make better informed policy decisions. And it, of course, ultimately benefits the public. So with increased access to information, you can make more informed choices to improve your health. So we're going to give you 45 minutes. I'll ask you first to get up, move to a new group with some new faces you haven't spoken to, and then you have 45 minutes to start developing these equations, as many as you can, and we'll take those forward in a later session to present them in a bit more detail. So warning, you will have to present at the end of the day, so start thinking about that now. Off you go. Okay, if I can have everyone's attention back. Hopefully all the groups have got a long list of sensitive data use case equations, and what we'd now like you to do is to vote for your favourites. So we'll shortly be distributing some stickers to each table. There are 3 stickers for every person sat at every table, and what I'd like you all to do is to ask yourself, if implemented, which one of these different use cases do you think would have the greatest benefit to the public? So you've each individually got 3 votes. Please put a sticker next to the 3 use cases that you individually believe will have the greatest benefit. And then we'll come back and I'll be picking on some people to tell me what they voted for. Okay, hopefully you've all had a chance to cast your votes. I'm going to come around. I think we've got some volunteers to talk about what they voted for. So if I go to this table first.
I wanted household data on social deprivation and income. I wanted to know about employment, both within the home but also in the sector, in terms of the farms and the supplies and the supermarkets. I wanted information about food banks and food bank use, so relating that to the households. And then I wanted some health data, particularly around health conditions that we know are related to effectively poor nutrition, and that would include obesity. And if we manage to get all of that together, then I would hope that we could begin to think about delivering improved food security and reduced food poverty at a national level, much reduced waste, and a significant move towards net zero, which is clearly one of our major targets. So benefits, the outcomes in some senses are also benefits, but improved nutrition, I think less ill health related to nutritional aspects, more sustainable lifestyles, potentially resilience to external shocks like war, but also shocks such as climate change. It would contribute to the circular economy because we'd be reducing waste.